large percentage of people are deficient in iodine.
Okay.
And deficiency in iodine comes because our diet is not rich in iodine. We don't have source. I mean, and the amount of iodine in iodized salt is just enough to make sure that you don't get a thyroid goiter. That's how it was. That's how it was put in iodine salt. So what we know, okay, is basically Japanese women have a very low rate of breast cancer, and American women have a much higher rate of breast cancer.
Mm.
Japanese women come over and they enter the United States and use our diet, their breast cancer rate is the same as ours, okay? So we know that there's something in their diet. And so there's a guy by the name of Dr. Abraham, he's in that book, who went to explore why that happened. And what he realized is that the Japanese eat a lot of seaweed and eat a lot of seafood, and there's a lot of iodine in that. And when he looked at the American diet, we have very, very little iodine in our diet. And so he actually developed a test so you can test for iodine levels. Now, what he realized is that iodine is protective of the breast and of the ovaries and of the prostate. And fluoride, which is in your toothpaste and in your water, knocks off iodine. Fibrocystic breast disease, which basically is very thick tissue in the breast. And if we were at a different forum, I would actually demonstrate to you the difference between fibrocystic breast disease and just a normal breast tissue. And a lot of women have fibrocystic breast disease. So if you test for iodine and your iodine levels are low and you give someone iodine, you can get rid of fibrocystic breast disease. Okay. And the test for iodine is a very simple test. It costs about $125. And the iodine is very, very inexpensive. Also, what he showed is that ovarian cysts, women that get ovarian cysts, if you give them iodine, it gets rid of their ovarian cysts, assuming that it's not a pathology like a cancer or it's not due to endometriosis, because you can get cysts from endometriosis on the ovary. So I think every woman, and unfortunately insurance companies don't pay for this, but I think every woman once a year should have an iodine test. What I've noticed is that women who have breast cancer, when I do their iodine test, that test is done is basically you stay away from certain foods for 5 days. On the morning of the 6th day, you take iodine, and then you collect your urine for 24 hours and you send it off. If you have enough iodine in your body, you will excrete most of the iodine that you took in by mouth. If you have not enough, your body holds on to iodine, a certain percentage of it. And every woman that I've done who's had breast cancer has an iodine level of 40% or below. And women, every woman that I've had that I've tested. Now I haven't tested every woman with breast cancer. A simple test. To me, if you did an iodine test on every woman at least once a year, and you check their level and it was low, it was say 65 or 70, then you give them iodine to protect their breast, as opposed to waiting until they have breast cancer and then you're treating them for breast cancer.